In this before and after presentation, we have an 88-year-old lady with a biopsy-proven basal cell carcinoma of the right lower lip. Under local anaesthetic, the lesion was excised and the defect is repaired with a transposition flap. At approximately 10 weeks follow-up, the wound has healed well and there is no functional interference with opening of the mouth. As can happen with transposition flaps, there is some pincushioning of the flap. This results from contracture of the wound around the flap, which causes it to buckle up. With time, the appearance may improve to a degree, and this may be hastened with intralesional cortisone injections. If necessary, the flap may be surgically revised. In this case, the patient was happy with the outcome.